Hello, I'm Dr. Daniel Cottam, and I'm going to continue up on our discussion that we've been having about gastroparesis. We've talked about the causes of gastroparesis. Today we're just going to do a little talk in just basic outline what we do to treatment for gastroparesis. So now we're going to go over all the treatments that we do surgically for gastroparesis, and they're in no particular order. We have number 1, cut across the pylorus. Number 2, cut out the paralyzed stomach. Number 3, place a gastric stimulator. Number 4, remove the entire stomach. And the thing that I'm most happy with that we've developed here, and this has been going on all along the United States for people who are interested in treating patients with gastroparesis, is combination therapy. So now the first one I'm going to talk about is cutting out the paralyzed stomach. So as we said in our last video, one of the problems with people with gastroparesis is they have food that sits in their stomach and rots. And you can imagine if you have rotten food in your stomach, it feels awful, you're nauseated, and you feel sick all the time. And so we've got to get rid of that. And so one of the ways that we get rid of the nausea is to do this. And so what if we're imagining this is our stomach and our fundus in our body? What we essentially do is this is the part of the stomach where the rotten food sits. And so we essentially cut this portion of the stomach out right here. And so we just take this out and remove it out of the body. And what that does is it turns the stomach into a tube that empties easily. Now, this works for people who aren't vomiting and who just feel awful all the time. And sometimes we'll offer this as its only therapy and just remove that. Now, however, we like to people who have severe nausea associated with their gastroparesis, we like to put a gastric stimulator in. And what the gastric stimulator does is it removes nausea. That's what it does. It doesn't really help your stomach move. It helps get rid of your nausea. And what it does is it sends electrical impulses into this gastric pacemaker. The gastric pacemaker body of the stomach, or part of the stomach, it pushes the food along and helps the muscles coordinate. And for some reason, when we pace it with the same pacer that they use for hearts, it makes your nausea go away. So oftentimes, if people feel awful all the time, they're not vomiting, but they just have chronic nausea, we'll remove the paralyzed stomach and place a gastric pacemaker. And what we see when we do that, we get response rates, meaning that they're able to live their life fairly normally and up in the 90% range. And if you compare this to medication, which is less than 5%, we're really doing a great service to people who have this problem. Now, if the patient has problems, and those problems involve vomiting all the time, as I said in my last video, what it means is the antrum is working, the pylorus is spasmed down, so oftentimes we have to cut across the pylorus. And so what that means is that I will actually make a cut on the pylorus, so it takes this valve and opens it wide open so it doesn't work anymore, so it physically can't contract down and spasm down and cut it off. And so what that does again is it takes that rotten food that could sit here, and as long as you drink and eat at the same time, it'll push that food on down into the small bowel without an issue. So we will offer combination therapy for people who have nausea and have bad pylorus spasm and vomiting, and we'll put a gastric pacemaker and cut across the pylorus. Okay? Now, occasionally, but not very often, we'll have people who not only have vomiting and only have paralyzed stomach, and their antrum can't squeeze anymore, and so sometimes in rare incidences we actually have to remove the entire stomach. So we'll actually cut across the small bowel right here and the stomach right here, and we'll hook a piece of small intestine up to the esophagus. And so in medical terms that's called an esophagojejunostomy, but the truth is that what we're trying to do is get rid of everything that causes your nausea, hook it up to a part of the small bowel that's really working, and that will now enable the patient to eat without chronic nausea and able to carry on their activities of daily living without ending up in the ER very often. Now, One thing I will say about this is that when we operate on all these patients that have this with one of these things, these in and of themselves are very small procedures, but post-operatively our patients, because they are gastroparesis patients, have much more problems with nausea. So it's not uncommon for them to spend a couple nights in the hospital, and if you come and see us, you should probably plan on that. But the most important thing you need to worry about is if you go and are going to have a consult with a surgeon about gastroparesis, and they don't offer these range of options for you. They only offer, say, a gastric stimulator, or they only will cut across your pylorus, or they'll only cut out the paralyzed stomach. These are all inappropriate, at least at this present time. People need to be understanding that they have options for multiple therapy modalities, and if you combine them, we take the response rates for our patients way up. And so when you're looking for someone to treat you, that's what you should be looking for. Now, we really appreciate you tuning in, and I hope this is just a brief overview of what we can do for patients who have gastroparesis, depending on what your symptoms are. And so we'd love to have a chance to talk with you and talk about your symptoms and see which one of these options would actually work in your disease process. I hope you've enjoyed our discussion today about the treatments for gastroparesis. As always, we'd love to have an in-person or telemedicine consult with you. And here at the Bariatric Medicine Institute, again, we're the only people in the Intermountain West who actually do surgical treatment for gastroparesis. And so if you have any questions, whether you're a candidate, reach out to us at our phone number, and we'd be happy to set that up for you. Thanks. Have a good day.